Across Ontario, public health is demanding access to your children's personal medical information, threatening parents with a month-long suspension if they refuse to comply. And I need your help to protect and defend medical privacy. As thousands of children across Ontario face imminent school suspensions because they are not handing over their private medical information to their local health units, parents are starting to resist this blind adherence to the demands of public health. If you value medical privacy and agree that the interests of public health do not override your right to keep your personal medical information confidential, then join me at our new campaign, StopVaccineCoercion.com. Using innocent children as pawns to capitalize on their medical information by holding them hostage from receiving their education when they have done nothing wrong is highly disturbing and I would say unethical. Sign our petition to stay involved and take action at StopVaccineCoercion.com. Now, I thought that school boards were all about diversity, inclusivity, and tolerance, except if you don't want to bend the knee to public health and want to uphold your and your children's right to keep your medical records private and confidential. This is all outlined by PIPA, that's the Personal Health and Information Protection Act. PIPA is very clear. If any act requires the consent of an individual for the collection, use, or disclosure of personal health information by a health information custodian, the consent A, must be consent of the individual, B, must be knowledgeable, C, must relate to the information, and D, must not be obtained through deception or coercion. Except what public health is doing to obtain children's personal health information is textbook coercion, lamenting them as a threat and coercing parents to either have their children vaccinated or sign a legally binding, ambiguously worded exemption affidavit, or threatening them with the harshest and strictest suspension order available, 20 days. And parents have good reason to be concerned with the unsolicited collection, use, and disclosure of their and their children's private information. Canada's Privacy Commissioner has just launched an investigation into the Power School data breach that compromised more than 2.8 million current and former students' data, with at least 35,951 staff and parental data included. The third-party student information hosting company Power School had its data breached in December of last year, data which included people's names, contact information, date of birth, medical information, and social insurance numbers. In 2022, the province's COVID-19 vaccine management system was hacked, leading to the compromising of hundreds of thousands of people's medical information. One of the world's largest medical testing companies, Life Labs, saw their digital health data records breached, impacting some 15 million patient records in 2019. Last April, an Ontario hospital cyber attack compromised the data of nearly 400,000 patients. These breaches are just a small tidbit of what actually occurs. They're not rare, and in fact, they're becoming more and more commonplace. How personal medical information and data is collected, used, stored, and shared is top of mind for many, especially given that data is big business. Last year, Kaiser Permanente had to alert millions that their private information was shared with tech giants. The investigation by Bloomberg found that major healthcare companies' websites were using online trackers to monitor users, often without patients' knowledge, highlighting how these sites share user data with third-party trackers. This is why it's more important than ever to protect your data and assert your right to keep your and your children's personal medical information private and confidential. Sign the petition and stay informed at StopVaccineCoercion.com because I'll be doing a series of reports on this topic, so please stay tuned. For Rebel News, I'm Tamara Ugolini. Don't forget to sign the petition and consider supporting this kind of investigative, solutions-based journalism at StopVaccineCoercion.com. That's StopVaccineCoercion.com.